Take inside the Senate Veterans Affairs Committee, where Chairman Jerry Moran, the Kansas Republican, led a hearing on the future of veteran community care contracts. Now, Senator Moran has long championed the Access Act, a bill that, on its face, sounds bipartisan, expanding mental health services for those who served. This is the same VA that the Trump administration has systematically undermined, hollowed out, and handed over to private interests piece by piece. So when VA officials sit before this committee and promise that their shiny new next-gen contracts will fix everything, quality metrics they've never had, dental networks they've never built, seamless coverage they've never delivered, where has this accountability been for the past several years?
Vision that as it was just described, to make sure that the providers fulfill a responsibility to provide information to the IG.
We do, Mr. Chairman.
Thank you. And you've talked a lot about measures of quality, actually the absence of measures of quality. Is there a standard way of, it's maybe an IG issue as well, how do you define, what's the criteria for determining quality of care? How do you measure it?
Thank you. So in the community care, in a managed care setting, quality of care is measured differently than in a direct care setting. It's just as important, it's equally as important, but it is measured slightly differently. In our setting, we are not handing over lives to the responsibility of the TPA. We maintain the responsibility of the veterans. We are not capitating, lives or anything like that. So the veterans' outcome measurements, their quality metrics, that measures both internal quality and external care quality. So focusing on the outcomes of our veterans, whether that's cancer treatment or cardiovascular or diabetes, whatever those disease pathways may be, the outcomes are what we want to make sure that we're measuring, and that will be indicative of both direct and external care.
And that's the outcomes, or whether a person got better, whether they recovered, whether their lives were extended.
Exactly. The outcomes, their direct outcomes from their disease pathway. And also in external care, there are national quality metrics, core measures, CMS measures, inpatient hospitalizations, your length of stay, your hospital-acquired infections. There are indications that are national metrics that we can pull systematically, that the TPAs in our next-gen contracts, we are going to require them to pull that. When you get down to direct providers like primary care providers, it does get more difficult, and that's where you need to rely on the outcome of the veteran's disease process. I mean, that's ultimately the measure of quality of care. Did the patient get better? Did the care work? So all of that is what's really exciting about what we're building, is that will be wrapped into the next gen, and we don't have that now. We just don't have capabilities to visualize.
And when you say we don't have that now, what you're really saying is we've never had that. I mean, it's never been since the Mission Act, or maybe since Choice. The ability to compare hasn't existed. But even within the VA direct care, that quality measure has or has not been present.
And the VA in direct care has a very robust quality metric system. I can't speak to it personally, but there are people who can, and it is very robust for veteran outcomes. I'm saying that that's indicative of both direct and community care, because veterans are getting both. So if their outcomes are good, then that's measuring both. What is new in our current legacy contracts, we do not require the TPAs we do not put into those contracts to measure quality. We have put that into our next generation contracts, so that is something that we then will be able to hold the TPAs accountable for, and we'll be able to get that information.
The current existing contracts, they have an expiration date, and is there a plan that then what you want to replace those contracts with will be available to replace it at the correct time?
Yes, sir. As we approach there's a rolling termination of the contracts. There are they don't all end at one time. So the first contract will end at the end of this year, and we will have to work with OGC and SAC to make sure that we bridge those or have plans in place, so that by the time the next generation of contracts are in place, there's seamless coverage.
And no one's raised the topic of dental care, and I believe that's becoming a new opportunity within the contract. Would you explain that to the committee?
Yes, sir. So in current state, our two TPAs, dental is within the medical contracts. In Next Generation, we've pulled dental out. It is a specialty niche kind of service. And we feel that one national contract for dental will allow us to build a more robust network and be able to, we've had some IG investigations with regard to dental payments. It will allow us to fix those situations, make sure that our rates are consistent. So there will be a national dental contract.
Does dental care for veterans cover the wide gamut of dental care?
It does. There are, and I will have to phone a friend on that. I can't speak to all of the dental coverages, but it is a robust services. There are robust services.
Mr. Topping, one of my legislative priorities, a significant one on this committee, remains adoption of the Access Act. It would build on the Mission Act and, in my view, help the VA deliver better access, convenience, quality care in the community, particularly for veterans with mental health and addiction issues. I want to express my appreciation for the feedback and technical assistance that you have provided in the Access Act. The Access Act passed this committee last year with bipartisan support. The ranking member and I are working together to reach an agreement on how to get it passed in the Senate. Does the VA continue to support the Access Act? And if it is enacted this year, like I hope it will be, would the Access Act help or hinder the goals laid out in the RFP?
Mr. Chairman, so Access Act was the first firefight I was dropped into after being confirmed, and I had a chance to work with your staff. Everybody supports the goals of increased access to mental health treatment for veterans. But when we came in, there were issues with how would we do this? How do we pay for this? How do we operationalize this? And the team spent a lot of time working on how we would do this. Number one, the goal on expanded access is absolutely the type of thing that VA can and should be working on. And one of the things that VA does perhaps better than even in the community, VA's mental health treatment. So that's number one. But then paying for it requires on how we're going to operationalize that. And so one of the things that the staff that we all worked on were, what are the tools that VA needs to operationalize this type of program? And so where we've landed on are the types of things, regional opportunities, the ability to pivot pilots that may be different in different areas based on different requirements, different capabilities, infrastructure. Those are the tools and capabilities that are built into Next Gen. So the things that VA would need to do to operationalize in a fiscally responsible way on Access Act are built into Next Gen. We have that capability in that contract. And so if and when Access Act is passed, VA stands ready to implement that.
They are compatible.
Yes, sir, they are.
Thank you. Senator Blumenthal?
VA officials sat before the Senate Veterans Affairs Committee and acknowledged, under Chairman Moran's pointed questioning, that for years there has been no meaningful quality measurement in the community care contracts that serve millions of American veterans. The United States government has been outsourcing the health care of the men and women who fought its wars, and it never bothered to ask, is the care any good? Did the patient get better? Did the treatment work? Those are not sophisticated metrics. Now, the VA tells us that the next generation of contracts, Next Gen, as they've branded it, will finally deliver what should have been there from the beginning. Quality accountability, outcome tracking, transparent data. It sounds reassuring. It sounds like progress. The Mission Act, which this administration and its allies celebrated as a landmark achievement, was rolled out without the tools to measure whether it was actually helping veterans. The Choice Act before it, same story. Not a word about the staffing crisis gutting VA facilities across this country. Not a mention of the billions funneled to private contractors while VA hospitals struggle to keep their doors open. When Mr. Topping described the Access Act as the first firefight he was dropped into, the metaphor was perhaps more revealing than he intended. Because a firefight implies chaos, disorder, a situation spiraling out of control. And that is precisely what veterans' healthcare has become under an administration that has treated the VA not as a sacred trust, but as a line item to be privatized, outsourced, and ultimately diminished. Chairman Moran, a Republican from Kansas, deserves some credit here. His questioning was sharp. He pressed on timelines, on contract expirations, on the gap between rhetoric and reality. He asked the uncomfortable question, we've never had that, have we? And the answer was no. But let's not mistake oversight for opposition. Senator Moran is working within a system that his own party has systematically weakened. The Access Act, which would expand mental health and addiction services, passed his committee with bipartisan support. And yet, here we are, still waiting for the full Senate to act, still negotiating, still working toward an agreement. Meanwhile, 20 veterans a day take their own lives. 20. Every single day. The dental care discussion was equally telling. The VA is now separating dental services into a standalone national contract after Inspector General investigations uncovered payment irregularities. When asked whether veterans receive comprehensive dental coverage, the official's answer was, and I quote loosely, "I'll have to phone a friend." Phone a friend. These are the people responsible for the health care of 9 million enrolled veterans, and they cannot tell a United States senator what dental services are covered. Here's the bottom line. What you heard today was an institution trying to build accountability structures that should have existed a decade ago. NextGen may very well be an improvement. The bar, frankly, is underground. But contracts don't heal veterans. Metrics don't treat PTSD. And promises from officials who rotate out every 2 to 4 years don't keep clinics open in rural Montana or downtown Detroit. The real question isn't whether NextGen and the Access Act are compatible. Mr. Topping assured us they are. The real question is whether this government, this administration, has the political will, the moral seriousness, and the fiscal commitment to make any of it real. Because our veterans have heard, "We stand ready" before. They've been told, "Seamless coverage" before. And too many of them are still waiting in line, still driving 3 hours to see a specialist, still falling through the cracks of a system that wraps itself in the flag on Memorial Day and forgets them by Tuesday.